this is Dawn at Cook Orthodontics of Dublin, and Dr. Cook might have recommended clear active aligners for your orthodontic treatment. So when patients come into our office, we have different vehicles of how we move teeth. Sometimes we use braces, sometimes we use aligners. So aligners are great at what they're designed to do, but they do have limitations. So sometimes patients will come in and they're hoping for aligners, but braces might be the better vehicle for them. But for patients that aligners are a perfect option, they're great at what they're designed to do. So when you come in for your new patient orthodontic exam, if Dr. Cook recommends aligners, you'll get an information sheet that talks about aligners. So we're going to talk in general about aligners. There are a lot of commercials on the market today about aligners, and there are popular names such as Invisalign, and that's actually a brand of an aligner. It's a lab that creates aligners, but there's different labs and different types of materials, but they all function very similar. So an aligner is a clear plastic tray, and it looks sort of like a retainer. Retainers are passive, they're not moving teeth, but aligners are active. Each aligner is designed for a specific tooth movement. So when you come into the office and the treatment plan includes aligners, we'll do a 3D digital study model. We do a 3D scan of your teeth. Dr. Cook goes into the computer software and he designs how the teeth should move. And our lab creates 3D models, and that's how the aligners are made. What you'll notice on this model is there's a little bump on the front tooth. We call it an attachment. And so sometimes the software will tell us, hey, that's a great place for an attachment. So sometimes we'll put attachments on teeth, and all of that is just a composite filling material that we use to help that plastic tray grip the tooth better than it would if the attachment isn't there. So if you have a tooth that's slightly rotated or trying to move in a certain direction, it gives the aligner a little more control on that tooth. So after the 3D models are created and the lab creates the aligners, you'll come back in the office and we'll explain how to use the aligners. In the office, we'll place the first aligner. It fits like a glove, it snaps in. Some patients wonder, will it fall out at bedtime? It fits perfectly and snaps in, so it's not going to come out on its own unless you actively take it out. The beauty of aligners is that we can take them out. Human nature says, hey, we can take them out. So the risk is they have to be in your mouth more often than out. So you have to wear them 20 to 22 hours a day out of the 24. So what does that mean? You have 2 to 4 hours to eat and snack, whether you graze throughout the day or you eat full meals 3 times a day with a few snacks. Every time you eat, you have to take the aligner out. Brush your teeth, put it back in. So that aligner is putting pressure on a tooth, and that's the only way the tooth is moving. Braces are on all the time, so we don't have to take those in and out, but aligners are patient compliant. They're going to be successful when they're in there more often than not. So when you come into the office, we'll explain how aligners work. You'll be given several sets of aligners. You might get 6 or 8 sets of aligners that you'll graduate through. So every 10 days to 2 weeks, you'll change your own aligner. If you've done a good job with the first aligner, the second aligner will fit. It'll be tight, but it'll fit. If the second liner goes in and it's not fitting right away, then that aligner before hasn't given enough time and the full tooth movement isn't done. So you'll just stay in that aligner a little longer before you graduate to the next aligner. So we look forward to working with you with your clear aligners.